The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. Don't let drowsiness get in the way of living your best life. Fall asleep, stay asleep, and wake up feeling refreshed with OrthoSleep. Its potency is designed to effectively address short-term sleep disorders due to anxiety, stress, or disruption of the body's internal clock due to shift work or jet lag. Get yours today at your local retailer or online at aor.ca or aor.us. Hello, and thank you all for tuning in to Supplementing Health. I'm joined here today by Lindsey Thomson, an ICU nurse from Salt Lake City, Utah. After last week's discussion with Jordan Bruce on what burnout is, along with signs and symptoms to watch out for, we will be discussing natural strategies for avoiding burnout as a shift worker. Thanks for joining me today, Linz.
Yeah, of course. Thanks for having me on.
So I'd love to start chatting by hearing a little bit about how you became interested in nursing and your journey in healthcare.
Yeah, so I have been in the healthcare field for decades now. I started as a CNA back in high school, just as like a little job to get away from family life after school. And then I worked as a CNA all through nursing school for about 10 years. And I kind of always knew I wanted to be a nurse. I just didn't know because I was the first one really in my family to go to college. So I didn't know how to get started. But being a CNA and seeing all the nurses and talking to nurses, I decided that's what I want to do. And I actually had a grandfather in the nursing home that I worked in. And the nurses, he had a brain tumor, but the nurses had him so sedated on medication that we really didn't get to interact with him at the end of life. And I decided at that moment, I wanted to be a nurse. I wanted to be a nurse that actually cared about patients, having a good relationship with families and just making that end of life experience different than what me and my family went to. And then started on my career, went to nursing school, started as a psych nurse, which was not for me. And that's where I really experienced burnout. And then recently transitioned to an ICU nurse for the last 2 years and currently in the midst of all the COVID world. So
Yeah, I very much commend all of the healthcare and emergency professionals that since you and your team and others in the field have to face a lot of emotional and physical stressors in your day to day, especially like you said, with the pandemic currently going on. And even when there isn't a pandemic, your job isn't easy, I'm sure. So I was wondering, what do you love about nursing that keeps you going on those challenging shifts? Like, what's your internal motivator to keep you going on the days that it would probably just be easier to throw in the towel?
Right. Yeah. Well, nursing is hard with long shifts, days away from our families, holidays away. But when you have those patients that are actually respectful and they really appreciate the care that you're doing, nursing is so much easier to do and appreciate when you have moments like that. Because, like I said, it's hard. But when you help change someone's life or you hold their hand at the last moment, that's what nursing is really about, like caring and seeing the long-term effects of what you do as a nurse. It makes it so worth it. And then just having family members right now, it's a very sad time. We don't actually have family members in the hospital. So these patients really rely on nursing, and you really have to dig deep of how can I make this patient's time in the hospital better, and just sitting at the bedside on PPE, they can't even see you, but sitting there holding their hand and just talking to them and getting to know like who they are, because they don't have anyone right now. And that's the compassion that nursing is, and that's what I love about my job.
That's awesome. I think it, I can only imagine the difference you make in their lives by doing that.
Yeah.
So even though you're able to keep your motivation high through those challenging times and you're able to be that beacon of hope and light for your patients, that doesn't mean that it doesn't take a toll both emotionally and physically on you. So how do you go about avoiding burnout when you have those emotional tolls or physical tolls on your body so that you're able to show up for your patients?
Right. I think the biggest thing is really understanding what burnout is. Because when I started as a psych nurse, I had no idea this burnout thing was real. But like going home and doing destructive behaviors and crying and emotions, like you really need to understand what the signs and symptoms are. So when things happen at work or you have a stressful shift and you take all those emotions home, and if you don't have a way to escape, you're really going to spiral downwards. So I try to I leave my shifts at work. I try not to take things home. And then on my days off, I really try and dive into self care. If it's working out or getting a massage or getting a facial, doing things that really make me feel comfortable. And it's 30, 40 minutes to an hour to just relax and take my mind off of work. Plus, I enjoy doing things outside. So I'm always at the lake. I'm always hiking. I'm always doing something outside because that's my release. It's clearing your mind. I don't have to think about what happened at work and just de-stressing.
Do you tend to talk to like your family members and stuff if there's challenging things that you experience that you need to talk through, or do you tend to go for professional help or friends in the industry? How would you handle that part of it? Because like some things, it's just, you can't just forget them, right?
Right. Yeah. And families are great. Like your family is your number one support system. But if they're not in the healthcare industry, they don't really understand. And nurses get each other, and we have all this nurse jargon, I guess you can say. Families are great, and it's nice to talk to them, but sometimes they don't like to hear the gory details that nursing brings with it. So I have a great support system with my coworkers and fellow nurses, and we can talk about the shifts because a lot of them are in the same situation. They're in the codes with me. They were on that bad shift, and we can talk to each other. And I think personally it's better to talk to your coworkers because it's not just a release for me. Maybe they need me to listen to them. So it's kind of, you can bounce your emotions off of each other and kind of debrief from the shift, and then you feel so much better. um yeah.
Yeah, that supporting community, I'm sure, makes a huge difference for sure. And it
Yeah.
can in any kind of career too, not just healthcare field, but I think any sort of stressful role or stressful experience, having that support network and community to talk things through or just help you work through those challenging life experiences, personal, professional, etc., can make a huge difference in how quickly you can recover from them.
Right.
Uh,
Yeah. Anyone that works in the public eye, they have bad shifts. It's not just healthcare workers. It's everybody. Every job is stressful.
Yeah, absolutely. So then in your role, you're often switching between night shifts and day shifts. And I
Right.
imagine that can really mess with your sleep schedules.
Oh,
So,
yeah.
I mean, I think we all know that sleep is important. We hear it all the time in the media, and it's a key to keeping your body functioning at an optimal level, keeping your immune system up. So what are some of your tips and tricks for getting adequate sleep when you're constantly shifting back and forth between when you're sleeping?
Right. No. So I'm always a go, 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 and I love the day shift schedule that I have. But when I switch night shifts, I used to get down on myself like, Lindsey, you're sleeping a whole entire day. I'm wasting that time. I could be doing other things. But I think now you really do need that whole day to catch up. Um, and I try and schedule my shifts 3 in a row so I can stay on that schedule. And then that last day, I can sleep all day, catch back up. Because this week, I just worked a shift, 5 night shifts in a row. And now next week, I'm going back to day shifts. So the other day. I spent 12 hours sleeping, and I needed that. Your body needs that time to switch its clock back to normal and get back on a normal schedule. Um, and then just setting your alarm, like, you may have a lot to do, but you need to go to bed early. You need to set that nighttime routine. Like, I come home from my shifts at 7 o'clock, eat dinner, 8, by 9:30, I'm in bed because I have to get back up at 5 a.m. And if I don't get that time asleep, I'm not going to be awake and alert and there for my patients. So I know sleeping, it feels like you're taking a lot of time away, but you really, your body, your mind, you need that sleep.
Yeah, absolutely. Do you ever use any supplements or anything to help your body relax after you've got those huge adrenaline spikes after a shift?
I don't. I know a lot of people use melatonin. The only thing I really do is drink like chamomile tea or like nighttime tea, but my body reacts to medication, so I just try and stay on my natural cycle as much as possible.
Okay, cool. So as you kind of alluded to, this year has been very much impacted by the COVID pandemic. However, obviously you've been directly impacted as you've worked directly with affected patients. So how has this impacted your lifestyle and well-being when many of us were able to stay safe at home and not have to deal with it day to day the same way?
Right. Yeah. And I was like a lot of people in the beginning. I thought this was just going to blow over. It was just going to be like the flu. It's not that serious. And then when I actually had to take care of those first patients and hold the hands of people that died from this pandemic, it really put things into perspective that this is real. It's not just a flu and it's not going away. And if I don't do my part when I'm not at work and not wear a mask and follow the government's recommendations in the CDC, I'm not being that good example. So it's really made me step back and say, you know what, Linz, you may want to go do all these things. You may want to go hang out with your friends, but I've really taken the time to step back and keep myself safe. I have older parents and older grandparents, and I don't ever want to put them at risk. So I've really stayed. When I'm at work, my PPE is so important. I make sure I wash my hands. I make sure I have it on tight and correct. And if I do work with a patient, I may possibly be exposed, I self quarantine myself for 2 weeks, and just do work and the bare essentials. Um, but I really try and just be the example for everyone, because a lot of people don't want to wear masks. I know it's awful wearing masks everywhere, but it's a good example, and we need to do it to slow this pandemic down and get to safe numbers.
Speaking of the masks, I know lots and lots of people have been mentioning mask knee or suffering from it, not even just mentioning it. Do you have any tips that you use to kind of reduce the mask knee when you're someone who has to wear them day in and day out?
It's basically just came a like part of me. My mask is like a t-shirt that I wear. You put your bra on every day, you're putting your mask on every day. Um, when I try, we have to, I don't know. I never take it off unless I'm eating. And then when I'm at home, I just try not to go anywhere that I don't need to, unless the grocery store. And then as soon as I get in the car, that mask comes off.
Uh, yeah, I think we all kind of feel the same way. It's a necessity, but they're not the most fun things for sure.
No.
Um,
And we were joking at work yesterday, like, we're all going to have cloth lung from wearing masks for 12 hours, 13, 14 hours a day after all this is done.
oh man. Do you have tips for maintaining a healthy immune system that you suggest for others who are experiencing stress regardless of profession?
um, Take care of yourself. Do what you need to do. Take your multivitamins every day. Do that 20 to 30-minute exercise if it's walking the dog or getting outside, moving your body. I know a lot of us have been trapped inside and we get stuck in emotions, and you really have to find a way to escape that. Again, wearing your mask, going outside for a minute, um, taking time for yourself, doing things that you enjoy, like read a new book or research something online. YouTube videos are great. Just, you need to do things for you that make you happy. Because if not, you're just going to get sucked inside. Eat healthy, like balance your meals. I know we can't go to restaurants anymore, so you really have to cook for yourself. So if finding some new fun recipes that are healthy that can boost your immune system, dive into that.
Okay, so I know throughout the conversation you've mentioned a lot of like working out, good nutrition, and I know that you're super passionate about that and have become or have started working with clients as a health coach. So do you want to speak a little bit about that and how you kind of transitioned into that and what you do as a health coach?
Yeah. So, like I mentioned in the beginning, I started as a psych nurse and didn't really understand what burnout was. At the same time, I was introduced with this workout routine to kind of help me avoid burnout, avoid medications, because I was seeing a therapist, and that just wasn't my vibe. Sitting in a room talking about my feelings really isn't me. So I tried to channel my emotions into something else, and that was working out, and got on with the gym. And I loved the way it made me feel. I wasn't taking all these patients' problems home with me. Like, I was really able to be in tune with myself and avoid burnout, avoid medication. So I started working as a health coach and really helping other nurses and other busy people that have these careers where they're stressed out. They don't really love themselves. Like, they're just finding other ways to help them grow as individuals. So I started working as a health coach about 2 years ago, and I really focus on using fitness and nutrition as a way to find joy in life. Most of my community is, like I said, nurses, healthcare professionals, respiratory therapists, physical therapists, CNAs, and busy women. And I really try and focus on personal development, reading books every day, listening to audiobooks, plus getting that 20 to 30-minute workout in, because who doesn't feel great after working out, moving their body? And it's such a stress reliever. And it takes your mind away for 30 minutes. That's what I love about it. And then I really help them eat healthier, because you can work out, you can do all these things, but if you're fueling your body with junk food, soda, like that just pulls all your energy from you. So I really try and help people meal prep, because 12 hours at a hospital is half of your day, it's half of your life. And if you're not set up for success on those shifts, you're going to be more tired, more drained. And then when those codes happen, those patients die, it's really going to drain you even more. So I really try and focus on finding that work-life shift balance with people in the healthcare field. And I absolutely love it. I love nursing, that I can help people, but a lot of those people don't really want to help themselves. So then I have the nurses that need the help, that want to be better so they can take care of these patients. And the two really work hand in hand. And I just absolutely love both and how they fit together.
That's kind of nice that you're working both the preventative angle as well as, you know, the sick care angle, right? Because there's kind of two parts to healthcare overall. There's the healthcare where you're trying to maintain that healthy lifestyle, maintain good health, and help the body function optimally, which
Right.
has so many names nowadays, right? It's alternative care, functional medicine, naturopathic care, whatever you want to call it, right? There's a million different names that people kind of refer to that same sort of bucket as. And then there's like almost like the sick care. It's when you are have a diagnosis, or you're not healthy per se anymore and you've got something to fix. So it's kind of nice that you get to work on both of those angles at once. And I also liked your note on nutrition, because I think many of us forget just how much the nutrients and the minerals and, you know, the phytonutrients and etc. that we put into our body actually helps maintain good hormone balance and digestive health, and all of these things that actually can impact how we process emotions and how we process stressful situations and how quickly we can rebound from those situations, right? Like,
Right.
two people could experience the exact same situation, but one who's taking care of themselves is less likely to be negatively impacted by that situation than someone who, when they're feeling down, maybe eats those feelings or has less productive or less healthy ways of managing them, whether that be, through addictions or even like just mindlessly watching TV afterwards or things like that, right? That can be thought of as escapes, but are actually almost trapping those emotions inside of us in a negative way.
No, yeah, exactly. I agree 100%. And it's when you're burnt out, people don't realize that those, like you said, watching endless hours of TV, just staring at something or putting drinking tons of alcohol. Like a lot of people don't realize that those things are not the greatest for your body, and you're just avoiding a lot of those emotions.
Yeah, absolutely. So unfortunately, we've reached our time here today. However, it's been an absolute pleasure chatting with you. So if our listeners wanted to get a hold of you to either continue the conversation or work with you as a health coach, how would they go about doing that?
Yeah, no, thank you so much for having me on. It's been so much fun just sharing my journey. You can find me on Instagram. My name is Lindsey Brooke RN, or they can email me. It's coachlindseybrooke@gmail.com.
Fantastic. And thank you, listeners, for taking the time to tune in. We would love to have you join us again next week as we discuss more ways to supplement your health. Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.